How dire is the situation at this hospital?
So, Kathy, as you mentioned, they said, well, announced rather, that they are terminating those funds mid-July, and as at the end of August, Sarah Fox will have to close its doors. So that means all the patients will have to be either discharged or transferred to other facilities, and the employees, the nurses, the social workers, the occupational therapists, and more, will either have to be moved to other facilities or be out of jobs by the end of the month. So it's quite a serious situation, and we've seen today, we went along to a lunchtime protest, or picket rather, that some of those employees were having, and they're very desperately trying to call out to the provincial department, to the national department, to the board that manages the hospital, to rethink this funding cut and rethink their employment status, because as it is, they are having to manage the exit strategy. So that is those transfers and those and discharging the patients that are currently there, and some of them will be without jobs by the end of the month. So they are trying to talk to management to see if there's any way to rethink this, but the way it looks now, it will be closed come month end.
Of course, jobs are just the one aspect that will suffer as a consequence of this closure. Let's talk about the patients, the young children who are being cared for. What kind of care are they receiving, and do we have numbers in terms of how many children will actually be affected by this closure?
Yeah. So the numbers that we were given were about plus minus 40 children that are sort of permanently at the facility, while others are in outpatients that come in by appointment. So they receive rehabilitative care, and as you said, palliative care. So it's children with special needs or children with long-term illnesses who need sort of care, and they need specialized care, actually. And one of the things that people were saying as they walked past and finding out that the hospital is closing down is it was very convenient to have the hospital based in the center of Athlone, where people in that community and its surrounds could easily walk there and take their children to these appointments. But if they are being moved to other facilities, people will now have to catch taxis, trains, buses just to get to those very important appointments. But we are told that for now, those children, their places have been secured at alternate facilities, so they don't have the issue of having nowhere to be sent. So that's not really a problem. And those transfers are starting quite quickly. They're starting this week, we're told. So that process is unfolding rather rapidly.
And of course, you know, one can't help but think in the background, Pheladi, of the transfer of patients that took place here in Gauteng out of NGOs that were providing services for people with special needs. So as far as that is concerned, I mean, has their homework been done in terms of where these children are being transferred to, and how involved is the government in that province in overseeing this process to ensure that we really don't have a repeat of some of the events that we've suffered in recent history?
Yes, Kathy, that's one of the concerns that the union there has. So the union there is the National Union of Public Service and Allied Workers Union, and they were just saying that, first of all, the people overseeing the process are these employees whose jobs may be terminated by month end. Whether provincial officials are also having a hand in that, we haven't heard, but they're saying they're having to sign all the documents and send them off to these alternate facilities. Now, they have every confidence, these employees, that the other facilities where people are being sent are, verified and are credible, and that those patients will receive the care that they need. But again, it's that thing of distance and people being so far from a facility that they need access to. So again, they were saying that on Wednesday only, they will be meeting with the parents to explain this process and give them details of where exactly their children are being sent, late or why they are being discharged. So I think it's being managed quite carefully, but it's still a cause for concern for that union, saying it happened quite abruptly and there hasn't been adequate planning. And they did say in earlier when we spoke to them that they fear that another life esidimeni could occur because of the speed at which this is happening.
Has the city been able to explain why those that budget was cut, Pheladi?
Yeah. Definitely. So in a statement that they sent me today, they said that corporate governance issues have arisen at the facility time and time again. So they are saying that some sort of maladministration has taken place at the facility, overseen by a board of voluntary members. So they're saying that they've given them enough time to correct those issues, and those issues haven't been corrected. So they have to pass on the service to another service provider. They weren't able to give us insight into what kind of corporate governance issues. So at the moment we're left guessing. And I mean, I'd sent out a request to speak to board members since Friday, and they hadn't gotten back to us. Even today they said to me, you know, they'll issue a statement and give me more details on what kind of corporate governance issues they are talking about, but I still haven't heard back as I sit here.
All right.